Hi, I'm Dr. Mark Whitmore, and I want to talk to you about snoring and sleep apnea. Snoring is a very common condition, of course, and it's often ignored due to embarrassment or lack of concern, but there is a big concern about snoring. Snoring is the most obvious indication of something called sleep apnea, also known as obstructive sleep apnea. Obstructive sleep apnea happens when there is an obstruction of the airway, most commonly the lower jaw and the tongue, that are positioned in such a way they fall back on the roof of the mouth and block the airway, block the ability to breathe. When one is asleep, this leads to big problems. Obviously, it leads to snoring. The noise that's created by the obstruction is what makes the sound of snoring. And the bigger problem is because of the limited amount of air that's able to get into your airway, there is either a total lack of oxygen or a very low level of oxygen for extended periods of time while the individual is asleep. So you can see that snoring is an indication of a very serious condition. Sleep apnea is something that is literally killing the individual one night at a time. There are also concerns about daytime sleepiness, automobile accidents. Plus, there's a very strong connection between obstructive sleep apnea and diabetes, certainly heart disease, and high blood pressure, and a lot of other health, full body, complete body health concerns. Traditionally, sleep apnea has been treated by something called a CPAP, or a constant pressure airway device, which is something like a mask that fits over the nose with a tube coming out of it. And there's positive oxygen, positive air pressure being pushed through that mask while the individual is asleep. Obviously, it's not the most convenient thing to wear. It makes a lot of noise, but it is helpful for individuals who are apneic, who are not having oxygen to their brain in sufficient amounts. Unfortunately, there is a compliance issue with a CPAP. A sleep physician recently told me that he estimates that only 30% of individuals with a CPAP use it consistently. So you see there are a large number of apneics, even that have been diagnosed or fitted for a CPAP, who are still in the sleep apnea. It's also difficult to travel with. You can't pack it in your suitcase. You have to take it through security at airports. And we've met a lot of people who have faced those difficulties also. A lot of folks have sought surgical procedures to address their obstructed airway problems. That includes a uvulectomy or a recontouring of the soft palate, the uvula and the back of the soft palate. Also, there's a common procedure called the pillar procedure, where little implants are placed into the soft palate and the back of the roof of the mouth. The success rate with the surgeries is very low, and obviously it's not a very conservative approach to the problem. This is where dentistry has gotten involved. For the last 15 years or so, there have been an evolution of development of some mouthpiece appliances that are extremely helpful, extremely therapeutic for people with sleep apnea. What these appliances do is when an individual has them in their mouth, it positions the lower jaw in a forward position. Turn my head in a forward position. When you do that, that gets the tongue and the lower jaw off of the roof of the mouth and opens up the airway. We have an appliance here that we recommend. It's called a SAAMNE Dent. I show it to you here on a model. I'm going to take it off the model now so you can see what I'm talking about. It's actually two separate elements, two separate pieces, a very thin, strong composite plastic material. And this fits on the lower, this fits into the upper. And when you have this in your mouth, it's made in such a way to where the lower jaw is positioned forward. It has adjustments on it. We're able to adjust the jaw further forward or further back depending on the patient's needs. This particular appliance has been available for a little more than 3 years. It's the latest and the greatest appliance, and it's in fact evolved even over the last 3 years to the type of materials and the limited amount of material that we use, which makes it easier for the patients to wear. An oral appliance is obviously a much more conservative and less costly and yet highly effective way to treat sleep apnea. Many of the individuals, as I mentioned earlier, who have had a CPAP fit and aren't using it have had tremendous results when we make them these sleep apnea appliances for the mouth. We also offer in our office a home sleep study, home sleep testing. Conventionally, to have a sleep test, you go to a sleep lab and you sleep in a bed, a sleep lab with all the electrodes and monitors attached all night, and they're able to monitor oxygen levels, what position that you were in, all these kinds of things, and that's called a PSG, or a polysomnogram, or conventionally called a sleep study. We now have a device called the Aries Watermark that allows us to do a sleep study in your own natural environment, in your own bed, in your own bedroom. We think that is a tremendous breakthrough. These devices have been available now for just a few years, and we're able to offer those to individuals at an extremely low cost, probably even 5 or 10% of the cost of going to a sleep lab. So very inexpensive. They're also very effective. For most people, we find that they're in the mild to moderate sleep apnea range, and that we're able to move ahead with a fabrication of a sleep appliance. Should we meet somebody who is not having, who has an extremely severe sleep apnea, as indicated by the home sleep test, or is not having as much results as we had hoped with the sleep appliance, then we're able to use those numbers from the home sleep study to send them on to a sleep physician to have further evaluation. In a nutshell, these are the services that we provide here at Whitmore Dental. We have been very active in this therapy for many years, and it is something that's really come to the forefront in overall health care. To find out more, please give us a call. Our phone number is 972-985-1580. We're conveniently located a block off the Dallas North Tollway. You can also find a lot of information on this on the website at whitmoredental.com. That's WHITMORE dental.com. Let me also say we meet a lot of individuals who come to us for this sleep apnea therapy who are not dental patients of our practice. When you come to inquire about the sleep apnea and the snoring, we are not going to try to talk you into having your teeth fixed. We're not going to try to do a bait and switch. We're not going to try to convert you to a patient in our practice. We treat many people who are not normal dental patients in our practice, and we just want to be real clear of how we love extending those services to individuals who are not going to be patients in our practice long term. That's certainly what we're here for. So just wanted to clear that up. Once again, if you have any questions, please give me a call. Look in the information that we have. Thank you.